Right, welcome everyone. This is our advice for this session of the Education USA PDO. I think it's the sixth one. Welcome. You are muted and your video is turned off. We are going to ask you to type your questions in the chat. You have to send it to Q&A Jorge Reyes. This session will be available on our YouTube channel once this is over, and please enjoy this great panel that we're going to have today. Next, please. Our session is going to be about staying well and healthy in the United States. And we're having three guests today. I'm going to introduce them later on. First, next slide, please. I'm going to talk about what is Education USA. Education USA is a U.S. Department of State network that promotes U.S. higher education almost all over the world. Advises potential international students to get to the universities they deserve, and offers accurate, comprehensive, and current information about almost 5,000 universities. We support U.S. higher education institutions in their efforts to recruit international students, and one of these efforts is this type of webinars that we have today. Next, please. And as I was saying before, we have a great panel today. We have Dr. Rupa Reddy, Assistant Vice President from Northeastern University Global Services. We have Nasha Shishagar, Senior Coordinator, International Student Program from Glendale Community College. And we have Elena Barrios, an International Enrollment Liaison Office of International Programs at the University of Texas in El Paso. Next, please. And I would like to start this panel asking you about what health services are available on your campus. Nasha, can you share a little bit about this services you have on campus?
Sure. So like Hector said, my name is Nusha Shishagat. I'm at Glendale Community College. At Glendale Community College, our health center has a variety of services that they offer. We have medical and mental health professionals. And what's a good thing to know about University Health Campus services is that when you come to those services, you are getting the same care as you would in a hospital. So the same level of care, meaning that the same doctors and nurses, marriage and family therapists who might assist with mental health counseling that you would find in the private sector, you are finding in our school services. So we have both medical and mental health services that are done in person with appointments or through group counseling. And during COVID-19, our offices have also opened up phone advising as well. They focus on prevention and education as well as treatment. So they will have different services like crisis hotlines, nutrition services. We even have a smoking cessation program. So if you're interested in stopping smoking, there's a lot of things that will help you get better and get well at Glendale. The office also offers free workshops and support groups throughout the year, and refer to students to specialists if they are not able to assist them. They also have a low-cost pharmacy on site. So typical medications that you might be getting through a pharmacy off campus, you can actually get on campus for a cheaper rate, which is always really nice for our students. And then for international students specifically, we also enroll you into an international student health insurance plan. And that health insurance plan provides extra coverage in addition to what's available on campus. They do teledoc services, mental health counseling, in addition to what you would find at the regular health care center. I think Hector's trying to unmute himself right now.
Oh, there you go.
There you go.
I'm sorry about that. I was mute by host. Rupa, can you share a little bit about the services that you have? Are they different from the ones that Nasha told us, or are pretty similar? Can you tell us about us a little bit?
Yeah, thank you, Hector. So at Northeastern University, we have several campuses. Our main campus is in Boston, Massachusetts. And we have a lot of services that are very similar to what Nusha just mentioned about Glendale Community College. Some additional services that we have are violence prevention services that is part of the health services. So any survivor of sexual or domestic abuse gets support. There is education there, and survivor services are provided. There is also, we have addiction support. So any kind of addiction, whether it is smoking, drugs, alcohol, any kind of addiction, the university provides support to those students with giving up the addiction, and then whatever additional support they need with that. We also offer our students emergency information. So our police department is a full-fledged police department. After hours emergency calls, generally police departments are also trained. There are mental health officers are trained in mental health pieces. And so we'll assist with wellness checks or even transport of a student who may need emergency transportation. So our university has all of those services that are available for students. I have been at my school, my university, for about 7 months now, so I am still learning. But as you go out to different schools, I think one of the things I love about universities is that before exams, they will have a week where they will help with stress relief.
Yes.
I remember at other schools where I have worked, we will have puppies on call, we would have massages, hot chocolate and popcorn, and free pencils. So usually schools will do things like that for students. So always good to keep an eye on those kinds of services as well.
Oh, thank you. Elena, what kind of services can expect international students from UTEP?
Hello, well, thank you for inviting me, Hector. My name is Elena Barrios, and I'm a proud UTEP staff and UTEP alumni. I graduated 1 year ago, so for me to be here, it's like amazing because I wanna let everyone know what UTEP has to offer. So that's really cool, thanks. So we have 2 centers. We do have the Student Health and Wellness Center, which is the same type of medical services you will receive from a family doctor. And they also cover nutrition services and wellness exams. These ones are open for men and women. They're different exams. And for international students, it's mandatory, but we have an exception for Mexican students. So if you're a student from Mexico and you don't want to pay the insurance with us, you can get your own insurance, but just remember that we need to check that it has like everything that we need covered. And for international students, it will be included in their like bills already. So they don't have to worry about, oh, I didn't add this. And we have our insurance that it's called the Student Health Insurance Plan. It's the name is CHIP. And we also have another department called the Counseling and Psychological Services Department. It's called CAPS. And in here we do group or individual counseling sessions. And it's not only for like mental health. It goes like with everything. Are you stressed because of your classes, family problems, or what's going on with the student life? Because sometimes we know that life happens and a lot of things come into our lives. So we want to put that attention to our students. And we also have a session and assessments for their career. So if they are feeling like stress and they're like, oh, I don't know, I'm between these 2 majors and I'm like this and that, we offer that support as well for them. We have workshops during the whole semester. Right now they're all virtual, but when everything was back to like the old normality, we had these workshops where we offer like even some yoga classes for our students. And it's really important to take care of our mental health. And we also have a crisis like number that it's available 24 hours, 7 days or for the week. So yes, thank you.
No, thank you.
And if I can add something there, because Elena brought up a good point, you know, your health services, you actually are paying for the support that that office gives you in your tuition. So a majority of the services that the health centers or psychological centers provide to you are actually free of charge to you as students. So we really encourage you to take advantage of those workshops. Again, these can be really fun things like stress relief, go petting a dog, doing an art class, art therapy class. So these are all really great ways to just let off some steam. You know, being a student can be a stressful experience, and the health center is there to support you through that in the same way that all of our offices are there to support you through that.
And I would like to add something.
So pay for it, you use it.
Sure.
And also, I think that sometimes, like, I remember that feeling as a student, that you are like, no, but why, what are they going to say if I go there? Or who's going to, like, talk to me? So all of these sessions are like 100% confidential. And I think that's something that all the students should know and be aware that, like they mentioned, it's like for them. And these departments are only for students, and they exist because of them.
And to that point, I'll say one thing, Hector, before we turn it back to you, is usually at your new student orientation, your international office will bring you information about your specific campus's health services. So don't be afraid to ask questions, because every campus may have something a little different from the other. And know that your campus health services is different from your health insurance. Your health insurance is usually for when you have to go off campus to see a specialist or for anything that is over and above. Routine care is done on campus at your health center. So don't be afraid to ask questions, because right from the beginning, you're not going to know everything. And I always say there is no such thing as a stupid question. The only stupid question is the one we did not ask. So please ask.
Yeah, that's a great point. Everything is included on your tuition already, and you can go and ask for all these services. I would like to ask the audience about one question, which is, what is your main concern regarding the topic of health and wellness when you're a student in the United States? So I'm launching a poll right now, and I hope all you can vote to this and help us out a little bit to discover which are the main things about this concerning. So maybe we can talk about the most popular things, but yeah.
You know, I'm seeing as it's coming in that exercise is a really big concern, as well as food intake and the mental health issues. So let me just address really quick the exercise, which might be slightly outside of what we're talking about today. But most campuses, not all, it's going to depend on the size of your campus, but most campuses actually have an on-site gym. It might be a small gym, it might be a really big gym, but there's typically some free services that you can take advantage of and go lift some weights or take some classes. At the community college level, and I believe at all undergraduate levels, there's also elective courses that you'll be taking as part of your program. And some of those elective courses are really up to you as to what you want to take. So you could take a physically related course, like a yoga class or a dance class. So there are definitely ways to get your exercise while you're at school. And of course, this is something I encourage every student to do, is to explore your local community. You know, you are coming to the US to study. Hopefully soon after COVID-19, everything will open up and be amazing. And you'll have access to everything like normal, but really take advantage of the time that you are here in the US to explore your local community. There are hiking trails, there are beaches, depending on where you are. There are trips to the lake that you can do. You can go skiing if you're close to a mountain. So explore your local community and see what it has to offer. But yes, lots of different ways to get exercise, and that is such an important part of staying stress-free and staying really healthy. So I just wanted to touch on that.
And just to let you know that mental issues are one of the biggest concerns about right now. So I think we're gonna cover this later on, but yeah, thank you for let us know about this topic. Next slide, please. Okay. What is the most important aspect of navigating health insurance in the United States? Nasha, can you help?
So let me say that I personally find health insurance and the healthcare system in the US to be one of the biggest points of culture shock for our students, because the system of healthcare in the US is very different than systems that you find everywhere else in the world. The number one thing that, going back to what Rupa said, is to ask lots and lots of questions about your health insurance policy. Again, as Rupa mentioned, most international student offices will be introducing you to your health insurance, how to use it, what it is. But it's important to read this book that comes with your health insurance that gives you your policy breakdown. It takes a little bit of time to get through, but it tells you literally everything that is covered, the types of services that are covered and any costs associated with them. Rupa, I think you and I can maybe bounce around this a little bit, but I personally have found that really understanding the health insurance policy can be a challenge for students. So I can talk a little bit about, so most insurance policies are one of two ways. It's either preventative care or accident and sickness insurance. Most international student plans are accident and sickness insurance. What that means is that you use that plan when you are sick, as opposed to preventative care. Preventative care is, I want to go get testing just to make sure that I am good and healthy. I want to go, testing is the best thing I can think of, but I want to go talk to a doctor and get a consultation about medication, for example. Those things are all things that are coming for the future, right? We're planning for the future. That's what we call preventative care. And most insurance plans for international students are not preventative care. So that's important to know, because if you go to an outside doctor, outside of your healthcare center, right? Healthcare center, you can go there and get preventative care because it's part of your tuition plan. When you go outside of your campus and you're going to see a doctor, you need to have health insurance in the US, or else the costs are incredibly high. But we want to go there when we're actually feeling sick and use our insurance to get treatment, as opposed to getting sort of preventative education. Rupa, do you want to add to that? I want to make sure I'm covering that well.
Thank you. I want to share a story because that was a great lesson there. We had a Japanese student when I was working in California, actually. We had a Japanese student come to us, and she had this like $3,000 bill. And she was really upset, and she said, why do I have this big giant bill? And so we started figuring out what had happened. We found out that she kept calling 911 and when she had a cold, and so they would transport her, right? Yes, I see Nusha's expression. They would transport her to the ER and they would say, you just have a cold, you need to go home and take care of yourself. And it somehow only happened on weekends, which was why she was calling 911. And so she had racked up this big bill, and she said, well, why doesn't my insurance cover these ambulance charges? And so the one big lesson was that the health insurance will not cover an ambulance charge unless there is a hospitalization. And it's a bad idea to call 911 when you have a cold.
Yes.
It is.
And actually, Rupa, that brings up a really good point. You know, I think one of the things that's hard to understand in the US healthcare system is that there are different levels of a hospital. So a doctor's office is where you would get primary care. Right. We also have another thing called urgent care, another level called urgent care, and then we have another level called the emergency room, or ER, which is what Rupa was referencing. So the best way that I can break this down for students is when we talk about going to the doctor, it's for what Rupa was talking about. I have a cold, right? It's not life-threatening. It's not something that's preventing me from doing my day-to-day stuff, but it's something I want to get checked out. For that, we make an appointment with the doctor's office. In normal life, we would go to our health center first, because that's a pretty common thing, and our health center can help us with that. But if the health center couldn't help us or needed us to see a doctor, we would make an appointment with the doctor, or if the health center's closed, we would make an appointment with the doctor. If you broke an arm, right, you would go to what's called urgent care. Urgent care is where it's not life-threatening, but it's something that needs immediate attention. That's urgent care. That costs less than ER, which is the emergency room. Right. So emergency room is, we cut our arm off and we're bleeding everywhere, right? We need that arm reattached right now. That we go to the emergency room for. So if you can kind of think about those different levels, that will help you understand, and they each cost different things. The doctor's office has very minimal costs for you. The urgent care is going to have a little bit more of a cost involved because you're asking to be seen pretty immediately. An emergency is right then, right there, life-threatening. That has the highest cost. And as Rupa said, most insurance companies will not cover your visit to an emergency room or to even urgent care unless there is a stay, meaning that the doctor said, yes, you actually need to be here. We're admitting you into the hospital for care. So
Elena,
that can,
I'm sorry, I told you.
no, that can be a confusing thing. I've had the same thing where one of my students, he didn't know. He was feeling sick. He called 911, ended up with a $5,000 bill. So these are things that are important to understand.
Elena, you were saying about not requiring medical insurance for Mexican students?
Yes. For us, like all international students required our insurance, but from Mexico, they could get their own insurance here in Mexico. I think it goes to the cases that we are in the border. So if they want to go to the doctor instead of being here in El Paso and go here in Juarez, it's fine. They just need to, of course, we need to check which insurance they're going to get and check that they cover what we need. Just to add something, I think that it goes back to Rupa, where just make all the questions. It's better to ask like, okay, I'm getting this, I'm having this flu. Should I just go in person? I think like for us, it's really like, oh my God, just take your car or an Uber or something and get to the doctor. But just ask like, if I hire an ambulance, would they like charge me? But of course, if it's an emergency, I know that the time it's not going to be like, hey, so I want to ask if your arm is broken or something. But just ask all the questions, and sometimes that I think it helps to everyone when it's like on this topic on insurance, is just ask different cases. Like, what if this happened and I don't have my contact information? What should I do? And if you don't understand something from your insurance, just ask. And yes, I think like all these offices and these centers are open, and you can also call and be like, hey, so I'm thinking about going to the hospital. What do you recommend? Should I go first there, or should I, if it's an emergency, of course, just go to the emergency room? But also for them to advise and like just let the students be aware of what they're going to be charged and all the possibilities that they might happen.
Yes.
I think just one last point there, right? I think one of the things, and my colleagues here will tell me if you agree or disagree with me. One of the things we see our international students say, well, my friend said this, or my friend did this, right? See, they are both nodding. And the friend may be in a different state of America. And so students have, this is a common mistake. So this is the time for us to tell you that this is a common mistake. It's a good idea not to do it. Do not assume that all states have the same insurance. Even within the same state, insurance plans may be different. So do not assume that all is the same. It's okay to ask questions. I will also tell you, insurance can be incredibly confusing. There are experts on insurance for a reason. Usually your school's insurance plan will have a breakdown and a chart to make it really simple and easy to read, but it is confusing. As an adult, it is confusing for me too. So don't feel bad if you find it confusing. It's okay, you ask questions till you've understood it.
Okay.
One thing, Hector, before we move on, I do want to point out too that a lot of the insurance plans will also provide additional mental health counseling. I know that was a concern that came up in the poll. So in addition to what your health center on campus provides, there are also typically a certain number of visits that your personal insurance, your private insurance will cover as well. And a question that often comes up with us, sometimes I'll be honest, sometimes with our international student population, there's reluctance or fear of using mental health services. I hear that a lot from students is, you know, well, if I go to the doctor, if I go for this mental health service, I don't want my future employer to be able to see that information. I don't want my professors to know, or anyone else in the office to know that I'm going for this thing. And I think it's really important to understand Elena touched on this earlier, the concept of confidentiality in the US. There are several confidentiality rules and laws in place to protect you. The one at schools that you'll hear a lot about is FERPA, the Federal Educational Rights Privacy Act.
The Family and Education Rights Privacy Act of 1974, I believe.
Good job, Rupa. I always mess it up. But what that does is that prevents, if someone was to call, right, and say, well, Elena's going to school there. I want to know what Elena's grades are, whether that's your parent calling, whether that's another administrator calling, whether that's someone off the street calling. We cannot release that information to the public. Your student educational profile is a private profile just to you. So only you have access to that. In that same way, the medical information, your medical history is covered in the same way by a law called HIPAA. And I won't even, Health Information Privacy Act. I know there's another I in there.
Privacy and Portability Act. Right.
Privacy and Portability Act. So what that does is when you go to a doctor's office, no one can call in and find out what you went to that doctor for. So whether it was a cold, through mental health services, no one can know that. That is between you and your medical professional to do. So I really want everyone to just feel confident in that anything that you do is really between you and your provider. No one else can find out.
And one last point, health insurance, particularly student health insurance, does not include dental treatment. If you want dental insurance, usually there is a possibility to buy it through your school. Some schools may not have it. You may have to purchase it privately. So keep all that in mind as well.
Okay, anything to all? I would like to launch another poll about insurance as well, about how many students right now already are on the insurance policy, and how many are not sure or not yet, because sometimes we don't have the insurance right now before we go to the United States, so it's okay. I mean, yes, okay.
And this is actually a good question to ask, Hector. What many students don't know actually is most of the time, your insurance that you purchase through your school covers you before you even arrive to the US.
Correct.
It normally will start sometime in August or sometime in early September, depending on when your school starts. And it typically covers you for the first couple weeks before you even arrive. So if the second that you come to the US, something happens, you can get that covered once you get your insurance card. Otherwise, it is a really great idea to look into a short-term travel insurance to cover any health needs that come up while you are traveling. But check with your schools before you go and purchase that. Check with your schools to find out when their insurance plan will start. And if it starts after you arrive, you're good to go.
Okay, well, next slide, please. Okay, what are some of mental health challenges the students experience in college, and what are your recommendations to face these issues? According to your experience, what you have seen in this time?
Yeah.
Rupa, would you like to start here?
All right. So culturally, I was actually very pleased to see the large number of students who reported that that was something that they were thinking about, right? I was an international student in California 20 years ago. I was a graduate student. And I was born and raised in India, and culturally, we just didn't believe in mental health or mental health counseling. So you just had to tough it out, right? You were expected to do what it took, and you were just expected to tough it out. The world has changed very much. When I deliver new student orientation, even when I do pre-departure orientation, I have had the privilege of going to both India and China and talking to parents as well. You know, when you come to the US, you have that ecstatic, the high, right? This is a new adventure. This is great. I'm here. I'm going to meet all these friends. Usually we see international students hitting the low within the second or the third week of the semester. Everybody has settled down. Everybody wants to be in their classes. Everybody is focused. People don't really want to go out and do anything during the week, especially. Students often begin to feel very lonely. And so they hit that low point. And when that low point hits, I find that students often tend to retreat. They become very quiet. They tend to stay in their residence hall room, and they generally won't say anything or do very much. And I would say that is something I would say, know the signs the minute you begin to feel low. The way to even avoid getting to that point is to make friends from the very beginning, but also to have a steady routine, right? Make a schedule. In America, we are very big on our calendar and our laptop and our scheduling, right? It's all about time management for us. We have a time for everything. So I have a dog. My dog knows 5 o'clock, 12 o'clock, 4 o'clock. That's when we eat. Without looking at clocks, my dog knows the time. So for us, it's how we condition ourselves, right? How we train ourselves. So I would say get into that habit from the very beginning. Have a balance of everything, right? Too much of anything is not healthy. So whether it's your study time, your free time, your food, have a balance of everything so that you have a steady routine and a rhythm of settling down. And if you do feel lonely, you are leaving your home, your family, right? This may be your first time living on a college campus, whatever the case may be. Know that it's okay. You are probably not the only one feeling that way. And the minute we find students talking about it and then getting an affirmation, oh my God, you feel the same way. Oh my God, you feel the same way. It normalizes it for us, right? We feel that I am not alone. Others are in the same position as I am. And then you find your group again, you find your strength. Your mental health counseling center will often have group therapy. Your international office will have programs to take you out. There will always be something for you to do. There is really no reason for a student to feel alone, except that they do it by choice. So I would say, make sure you make friends right away. Find the people you get along with, find the people who are different from you as well. Some of my best memories, my first friend is from Lebanon, and she has seen me through good and bad times. And during the millennium, she took me home to Beirut and made sure I was never alone. So our friends can be really helpful to us as well. Those would be my tips for you.
Elena, in your case, you were talking about you were like dealing with a lot of Mexican students. What are some of the challenges they're facing by being away from, well, not that away from home, but in a different culture, which is the United States?
Okay, so for example, I was raised in Mexico and all my school and everything was here in Juarez, but I decided to attend UTEP for my college, right? For my undergrad level. So something that I experienced, and it was kind of like, wow, even though we're in the border, there is a cultural shock because we are really different, even in the classroom, and that happens everywhere. For example, in Mexico, I remember like having my friends since kindergarten, and it was just more like, you know, they were like my brothers and sisters. So we were used to that, and it was like they knew my family and we knew each other. And Mexico, and more here, Juarez, it's more like a pueblito, a small town. So we know each other. And for me to go to a campus where instead of being in a group of 30 students to a classroom of 200, for me, it was a shock. So for us in Mexico, it's really like common for us to have a relaxed environment with even with the professors, more like, hey, professor, more because you feel comfortable, right? So imagine having like a classroom of 30 and then randomly on a classroom of 150 in an auditorium and with a professor that you don't know. So you were like, oh. So my recommendation is have a group. Even like when I went to UTEP, I started like, I have my friends that attended UTEP and everything, but I decided to get out of my comfort zone and meet new people. So part of my group, it was international students, which I really appreciate. Like, I love international students because I love knowing different cultures. And even though we were both from different countries, exchanging their information and being like, hey, so you gotta try these tacos right here on the next store, we should go. And I also had an opportunity to go on an exchange in France. And this was like another cultural shock for me because we receive stereotypes that we're like,
Yes.
oh, but in Mexico, one time I received a question like, is it true that Mexico have like for breakfast every day burritos? I'm like, yes, but that's sometimes me because I enjoy them. So it was kind of those questions, and having the opportunity to meet people from other countries and also learning about them, I think that even made my exchange 10 times better. And right now, they're my family from Europe. So we should all have that experience of, yes, I'm going to another country. We know the cultural shock that you might experience, but just remember your family will be there for you. And even if it's not like in person, if it's virtually, thanks to social media and all these platforms that we have now, we have that advantage. Imagine before with letters and everything.
Right.
And now it's more about like, it's your turn for you to make another family here and know about all these other cultures. So make friends, go and volunteer in these different student organizations. You will be surprised of all these different perspectives, and you will get like, you have an advantage because you will learn about other countries, not because you read it or you see it on movies, because you're experiencing that and you're learning it from these different students with different nationalities. So yes, that's my tip.
Masha, anything you want to add?
Yeah, I think Rupa and Elena both touched on it. You know, making friends is really, really important. But I'm going to be honest with everyone on the phone call, that takes work. Making
Yes.
friends is, and both Rupa and Elena mentioned making friends with international students, which is awesome because you're going through somewhat similar experiences, right? Coming to a new country and adjusting and kind of dealing with the weirdness of America. I hear it a lot. Americans are kind of weird. In the first couple weeks, we come off weird because the way that we interact, the way that our society is built is a little bit different than how it's built back in your home country. So one thing that I always talk to my students about is that relationships in America have lots of different levels. So in other countries, you are friend, family, you're a stranger, friend, or family.
Right.
That's it, right?
Right.
In America, it's not that way. In America, we have stranger, then we have acquaintance, then we have friend, then we have best friend, then we have boyfriend or girlfriend, and then we have family. Okay, so there are, and then coworkers, colleagues, somewhere in there, little different kind of a relationship.
Right.
Those different levels of relationships can be difficult to navigate. So oftentimes what I hear from my students that's very confusing for them is they will have classmates that they do school projects with, hang out with in class, talk about things within class. And then when they pass each other on campus, that person doesn't even say hello to them.
Right.
And that can feel like rejection. That can feel like isolation because you think this person is your friend because you worked with them on group projects, right? They're not quite your friend yet. So it actually takes work to move from that level of classmate or acquaintance, somebody I know and I do certain things with, but that I don't really hang out with outside of those things. That's what we call an acquaintance, right? You know each other for a purpose. It takes work to move from that purpose up to a level of friend. So what Elena mentioned earlier is kind of a great way. It's like, oh, you know, what's a good restaurant around here for tacos? Oh, this place. Oh, hey, would you like to go with me? I'd love to have a partner to go with. And so you move that person that you're talking to outside of the classroom and you move them to a social area where then you get to know them, right? Clubs are a great way to do that on campus without you necessarily having to do that kind of work because they're normally set up around, let's go volunteer here, or let's do a soccer club, let's go, you know, whatever, let's have a baking club, and you already have sort of an interest. But if you want to work from making friends outside of the classroom to an actual friend, I'm going to tell you that that work's going to rely on you. It's unfortunate, but as Elena said, you are the ones who are leaving everything that you know, friends and family and all that, and you're coming here. With international students, they're much in the same boat. With Americans, which I encourage everyone to have American friends as well as international, as well as international student friends. Americans already have their system. They already have their friends. They have the person that they've been hanging out with since kindergarten here. So it takes work to break in. So I don't want you all to feel like the efforts that you're making are going unnoticed. They just sometimes it just takes a little bit more effort. And I just want to be honest about that because I see my students struggle with that a lot.
Okay, Rupa,
I
your
want
final comment?
3 things. Yes, thank you.
Okay.
So yes, to Nusha's point, actually make friends from the heart, right? I think I would always tell my students, make friends with Americans, particularly if you are living in the residence halls. Generally, the American students have a car. If you want to go shopping, they will be the ones to help you, right?
Mm-hmm.
And when international students make friends with American students, so many times I have seen them get invited for Thanksgiving or for Christmas to the American students' house, and you get to learn American traditions. So there are some beautiful friendships that come both ways. But speaking again to mental health and wellness issues, there are 2 pieces that I will speak very openly to you. Depending on what school you go to, don't feel the pressure to drink alcohol just to make friends. That is a big part of college campus cultures. And very often students feel that if they say, no, I don't want to drink, then that group of friends is not going to be my group of friends. That may not be the right group of friends for you. If you are not into drinking, I strongly advise you to be mindful of your health and find your affinity group. And that's the same thing with sex. We have students who feel pressured, and very often your health center will have sexual health lessons as well, prevention lessons as well. We have a concept on college campuses called bystander intervention, where we learn how to help somebody who is being pressured to have sex. And so that is a very real thing about college campuses as well. I say this openly to parents of international students as well. I say, I'm going to talk very openly to you today because this is the reality of college life. So know your ground, know what you will or will not engage in, and be okay. It's okay to say no. In many of our cultures, we have learned not to say no. It's okay to say no. Feeling the pressure, having the worry is an impact on our mental health as well. So this is all woven in together.
And I want to add to Rupa's point right there. It's not only okay to say no, it's expected in American culture that you say no if you want to know. Okay. So it's expected that you speak your mind and you put your boundaries. And on that point, just real quick before we move on, I know, Hector, there's more, but you know, sometimes I had a student one time who came to me on the issue of making friends, right? And as Rupa said, find your group. There was a student who said, I've tried so many times to make friends with this one person, no matter what I'm trying, he or she is not interested. And I said, that's okay. That's not a reflection on you. Yeah, it's not a reflection on you. It's a reflection on that person. And maybe they just don't have the space to take in another friend and give in a really truly true friendship way, and that's okay. So know that not everybody that you approach will accept that approach back, and that's fine. There will be others that will. So put yourself out there, know your boundaries, know what you're comfortable with, and know that other people will have their boundaries as well.
Okay. Anything to add, or we can go to the next slide? Let's go to the next slide, and I'm gonna ask you, okay. What are your recommendations and tips for international students to stay healthy in the United States? Let's try to keep it to 3 to 5. Are we okay with that? 3 to 5 recommendations and tips for international students to stay healthy in the United States?
Elena should go first.
Okay, I think the most important is, well, for me, it's to set a routine, because and more right now, like I think we're all experiencing, we need this advice. Set a routine. Even though your classes will be virtual, in person, hybrid, it doesn't matter. And Rupa mentioned this before. It's really important that you set your times And this will help you in everything, in your classes, in your personal time, in your like activities, managing, even like everything, even your money. If you set a routine and you say like, okay, I'm going to go to the supermarket every Friday, and I'm going to prepare the meals for the week. That's also like getting to your routine, your calendar, and it will help you a lot. Another thing that I think is really important is get enough sleep. We know right now we can get a little bit of anxiety, and we like this could escalate more between like the time if you're stressed. But even if you have a really important exam, get your hours of sleep. It will probably help you more if you're relaxed and you have like you are feeling better than if you I did this in college and I will never do it again. I now respect my sleep schedule, because sometimes I remember that I was like, okay, I'll be really relaxed, but then one day before the exam I was like, oh, bring me that coffee, and I was just drinking a lot of coffee and being like till 5-6 a.m. and then arriving to the exam until one time I felt that the classroom was shaking, but it was me, because for all this caffeine that I took. So get enough sleep, and also be kind to yourself. It's okay not to be okay. So if you're feeling the way you're feeling, it's fine. Never judge yourself and be like tough with you. If you feel comfortable with sharing it with your advisors, go ahead and do that with a friend, with your family, but never think that your feelings are not okay. So it's okay not to be okay. And that's for my part.
Okay, Rupa?
I'll let Nusha go next.
Oh, okay.
Oh,
So I have a very easy acronym for mine, and it's SEAMS. Sleep, eat, experience new friends, experience your surroundings, experience workshops on campus, move, exercise, go walking, hiking, whatever you personally like, yoga, and study. Can't forget that we're here to study and we have to balance that out. So if you can remember SEAMS, sleep, eat, experience, move, and study, I think you're good.
That's awesome.
oh, that's awesome.
So if you haven't heard of this phrase, it's called freshman 15. Usually, right? First year students are also called freshmen. And usually the saying is that freshmen put on 15 pounds, that's 7.5 kilos, in their first year when they come to campus, because usually students will enjoy eating pasta, pizza, French fries, all the food that is rich, right? And so students tend to put on a lot of weight. So keep that in mind, that is a real thing, and if you can avoid it, avoid it. Hydrate. Always have your water with you. You'll get a free water bottle from school. Remember what we told you, nothing is free, it comes out of your fees. But use the water bottles that you get, make sure you hydrate. And I don't know if you know this, but the new joke is COVID-19, because I certainly have about COVID-10 on me right now.
They call it the COVID-20.
It's a real thing. Right, COVID-20. It's a real thing, right? The need to move is real. The need to be aware of health is very real. And even in the virtual world, like Elena said, I am seeing so many virtual races, and you have the ability to use indoor gyms and things like that. So be mindful, be very mindful. And one of the other things to do for mental health is have a gratitude journal every day, every night. Think of 3 things that you are grateful for, and see what that does for you. It's been a great practice for me. I have always done it. Even when I post on my social media, I talk about my beginning usually is love is, and then I will tell whatever I wanted to say for the day, or I will talk about my blessings. So think about that as you are engaging in your journey. You are so lucky to have this opportunity to come to the US. You have your family who is supporting you and spending all this money for you to go to school. So take care of yourself so that you are able to succeed and make everybody proud. And you have all of us, your administrators are there with you.
Thank you. I think you were mentioning a very important topic, which is following next. Can we go to the next slide, please? And it's about COVID-19. What are your tips and recommendations regarding this virus that we have right now, and how to stay healthy on campus?
Yeah, I tell you this, I hate that mask. I hate the
We all do.
mask, right?
We do.
We all
I
do.
am a Mickey Mouse fan, so I have found Mickey Mouse mask for myself. Find your fun in this difficult time, right? Follow the rules. There will be quarantine rules depending on where you are coming from or where you are going to. You will need to make sure you are covering and protecting yourself. Remember to wash the hands the way we are being asked to do it. Make sure that you keep your distance from folks so that you are maintaining healthy habits. And the minute you feel unwell, call your health center, call your provider, make sure that you don't wait. There is nothing wrong. This is a sickness, it's all around us. If folks get it, they get it, get help right away. So those would be my tips for staying healthy and safe.
Lucia, can you share some recommendations?
Yeah, I think, whether it's COVID-19 or just anything in general, I know sometimes as young professionals, we tend to think we're a little invincible. It won't happen to me. If I get sick, I can beat it, right? So sometimes that leads to more risky behavior. So just remember that we're not. We all have the same risk of getting sick that anybody else does. And take care of yourself and your neighbor, right? Even if we're inclined sometimes to just say, well, I don't think I'm going to get sick, so I'm going to take that mask off. We have to remember that we're protecting everybody around us as well. So if you're not going to do it for you, do it for the person next to you. Do it for your neighbor, their family, your abuelita, right? Do it for someone else.
Okay. Elena, anything to add to the recommendation?
Yes, I think something that I added to the list, which I thought it was really important, is that always retrieve information from reliable sources. What happened to this? With social media and the la prima de una amiga and the family that it's all over like the world and the friends and everything, you open your Facebook and you get like 10 different news that sometimes like they are fake, or then you just click and it's nothing to do with the title. So for example, from my something that I saw on social media, they discovered the vaccine like already 3 months ago, and now you see and they're like, no, they're just trying to figure out like what's going on and everything. So always retrieve information from reliable sources. Don't let that el tío de un amigo, la prima, and the family or the friends tell you like this is going on. Be like, oh, okay, where did you get that information? After that, you do your research and you say like, oh, that's actually like reliable, perfect. But this could lead to us to be like scared and cause like those feelings that you don't know what's going to happen. And it could be like worse for mental health as well. Another thing, like from the university perspective, I think it's really important to stay connected to us, to the university for official updates. Again, it goes with the same reliable sources. Every school is different. So for example, my sister, she's in another university, and what is happening and what's the rules and updates that are all going through that university are different from the one that I work. So it's okay. I always listen and I always try to do my research to see what's going on in different schools, but I will only take what UTEP advice. And with this, always when you're going to make a comment or a point, remember the other person as well and have facts. Like if you're going to mention something, be like, hey, so yes, I saw this here and this happened here. And of course, wear your mask, wash your hands, keep the distance. And it's not only for us, it's for everyone, for our family. We want to know that the students and everyone that are with our family are respecting these new instructions. So it's important. If we do it, we expect that other people do it as well. And always be informed in different cases. Like if you're feeling this I don't know, your throat or you're feeling the symptoms, always talk to someone. Of course, not in person, you can call because we know right now it's not the safest thing, but don't be like, oh, what if? And never, 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 never Google your symptoms. Never. That's my last advice.
Google always tells you you're dying, right?
Yes.
Okay. Okay.
So
Well,
just one more thing, Hector, before
yeah,
we go.
sure,
I know many students from Mexico may drive across the border, but if you happen to fly, just know that airlines don't necessarily have to space you out on the plane. So you might be sitting directly next to somebody. Don't feel like you can't take extra caution and wear gloves or take wipes with you and wipe everything down before you sit down, hand sanitizer. You know, now is the time to be more cautious than not. So maybe in the past, someone might have been like, you're OCD, you're a germaphobe for doing something like that. Do it. Do it now. Protect yourself. Better safe than sorry.
Definitely. Okay, so let's hear from the audience what kind of questions they have. Remember that you can send those questions to Q&A Jorge Reyes. And Jorge, do you have any questions for us?
Yes.
Great.
Yes, never taking. So,
Jorge, you're breaking up a little
bit. Yeah, you're breaking up a little bit, Jorge.
Maybe you can type for us if that's easier.
Yeah, you can type it.
Okay, can you hear me better now?
Yeah, a little bit.
Okay. Okay, the first question is, many schools are requiring students to quarantine on campus/hotel before starting school this fall. What support services would an international student have during this period?
I can take it because Massachusetts has a quarantine requirement, and you should check with your campus because the residence life and housing department will have very clear instructions for quarantine, and they will partner very closely with dining services. And so what I am seeing are plans where students will be told, okay, now this floor, this building, go down, get your food. And you know, it's only takeout right now, so you cannot eat in the dining hall, but there will be instructions on go get your food and bring it back to your room and eat. And within, you know, on floors, depending on whether there is a lounge, there may be an opportunity to sit with some distancing and eat with friends. So please take a look at what your campus is providing you. There are emails going to students. The Residence Life and Housing websites are very much preparing for quarantine. And housing, dining services, sorry, are also very much prepared so that students do not all go down at the same time.
Okay. Jorge, any other question?
Yeah. Okay, this is a two-way one question though. During this pandemic, what kind of insurance should international students get? And just taking with this one, currently with the COVID situation, has anything changed in the flexibility of insurance policy? I just wanted to put those together.
Yeah, thank you. Thank you. Nasha, can you think us a little bit?
Yeah, that's a good question. Most insurance companies, I can't say all because I wouldn't know all, but most insurance companies that your schools would contract with have actually expanded. So I talked a little bit earlier today about the difference between preventative care and accident or sickness policies. So most of the time, accident or sickness policies wouldn't cover your COVID-19 testing, for example, unless you were physically sick. A lot of insurance companies have expanded the testing ability specifically for COVID-19 in response to the pandemic. This will vary based on your insurance. So this is one of those really good questions to ask if you are concerned at all that you may have come in contact with somebody, because COVID-19 is interesting. A lot of us who get it do not experience symptoms at all, right? So there is awareness of that, and so there is some allowance for that in the insurance community, but it is definitely important to ask those questions. And as far as the kind of insurance you should get, your schools will handle this differently depending on where you're going. Some schools will require that you take their insurance policy no matter what. My school's like that. Some schools will allow you to waive out, like Elena's. What's important, I think, when you are deciding whether or not to waive out of your policy is to purchase a plan that is very, very similar to what your campus offers. International student insurance plans are set up in very similar ways across all institutions with specific minimum amounts. So for example, $100,000 coverage for the year or $250,000 coverage for the year. And the reason for that is medical costs in the US are quite high. So if your school allows you to opt out with any kind of insurance plan, but you purchase a plan that's very, very cheap, but doesn't cover a lot, you'll actually pay for more out of pocket during the year than you will had you paid a little bit more up front. So if your school offers an opt-out and you don't fully understand how to compare plans, talk with either your health center, because there are doctors there who understand health insurance plans, or talk with your international student office before you decide to do those things.
Elena, anything to add? Or can we go to another question?
Sorry, I had it muted. No, just like what Nusha mentioned, it depends on each school, and always ask those questions to your health center, your providers, your insurance providers, and always ask that case, like right now, what's like if it will change and if the price is going to be higher, if it's going to stay the same, and always make the question like, what if? So what if I get COVID? Or what if I get something? What if this? And that way they can explain, like, if this happened, you will need to pay this and this. So it's more into like each school, like Nusha mentioned it. And, but always try to be informed and don't be scared to ask questions directly to the insurance about it. Like if it covers or no, and that way you can, like Rupa mentioned this before, if it doesn't cover, and for example, you need a dental special treatment, just start planning that you will need to add that coverage.
And actually, Elena, that's a really good thing you brought up. I meant to mention that earlier. Most health plans are not dental and vision plans. So if you have regular routine eye care needs, dental needs that you want to do, you can generally purchase additional insurance plans to cover that, but they're normally not covered with your normal health insurance plan.
That was a question that was asked.
Okay.
Yeah, you actually answered it though.
Very answered. Thank
Yeah.
you. Any other?
Yeah, sure. This is a question, well, regarding health centers, but perhaps you can get deeper into this one. What are doing the health centers to ensure a healthy stay in the universities during the COVID-19 pandemics, and what are they going to do about it?
Oh yeah, it's a great question. I mean, healthcare services are overly aware, I would say, of all the recommendations and guidelines available by not only the CDC, the Center for Disease Control, but also each individual public health office. So for example, in my area in Glendale Community College, we are under the LA County Public Health Department. Any recommendation that is issued by those agencies, by our states, our entire schools are following them. So wiping things down in between visits, spacing people out inside waiting areas, scheduling appointments versus having drop-ins, right? So all of those safety measures that you would expect to be put in any private company, to be put in any public hospital, you're gonna find at your schools. The safety of our students is #1 top priority for us. We would never do anything as institutions to put you or your family members or your friends or your roommates, anybody in harm's way. So just know that and know that that's what schools lead with, is your health and wellness.
Anyone else, or can we go to the next one?
Next one.
Let's go. Okay, let's go to the next one. Jorge?
I'm sorry, just one thing. And it also takes like what the university is going to do for us to take care of the students, but it also relies on the student. So just follow every measure And if it's like only by appointment, do your appointment, and remember to respect the time of the doctors and the people that work there, because of course they also want to take care of themselves. So wear a mask. Don't expect them to be like, hey, your mask. It's more like college level. So remember that and be responsible. That's it.
Okay, great. In a hypothetical case that I arrive to my university for the fall and I test positive on COVID-19, my insurance policy should cover hospitalization. What is your advice on that? In Mexico, we would usually call the doctor with that specialty and get medication on that. In the US, how would that work?
Rupa, do you want to take that one?
I think if the student, sure, thank you. I think if there is a hospitalization, then the hospital will provide all the medications as well as instructions on what needs to happen, right? If a student arrives in the United States, to the best of my knowledge, even at airports, they are still doing temperature checks, right? And there are quarantine laws depending on the state. So first of all, be aware of the state where you are going to school and look at the state's website for directions. Your school will have very clear instructions. Take a look at their health services page for, now all the health services websites have got who to call if you have COVID, because don't just show up at the emergency room or the urgent care like we talked about earlier, because that is not the place to go. The instructions are call the number and you will be given directions. I know in my neighborhood, my neighbor actually is a nurse and she came home with COVID, and the ambulance was called and she was transported. There are certain spots where only COVID patients are being taken, right? So take a look at your school's website, make sure you know. Our handout has that for you. Find out information ahead of time, just in case, right? Nobody wants to get sick, but have the information what to do just in case, and follow the directions that you are given. You will get very clear directions on what you need to do. And the medications, you will have clear information as well.
There's a handout that Rupa, Nasha, and Elena made for you, and it's available on the chat. There is a PDF that you can download, or there's a link to it. So feel free to have that on your agenda or in your folders when you travel with that. Any other questions, Jorge?
Yeah, we have a few more questions.
All right.
What if my family / friends visiting the US? Do they need to get insurance?
So this is actually a great question. Depending on which country you're coming from, travel just to visit may actually not be a possibility at this point in time. So for example, anyone coming from Mexico right now cannot come to the US unless their travel is essential. So US students coming to the US, that's considered essential because you're coming to study. If you were coming for work, that's essential. But for general tourism, that's not an option at this point. So if your parents were thinking about accompanying you across the border to help settle you in, that may not be a possibility at this point in time. I want you folks to be prepared for that. But let's talk about in normal life, okay? In normal life, when all travel restrictions are open, yeah, travel insurance in general is always a really great idea, because you never want to be someplace, you know, the US does not have a public health system like in many other countries. I've traveled to other countries where if I was sick, I could go to that hospital and get taken care of. In the US, you can get taken care of, but it's going to be a big bill. So it's always a really great idea to have travel insurance. There are many companies that will offer those for very short periods of time, 2 weeks, a month, relatively low cost. But yes, that's a great thing to encourage. Just know that that may not be an option quite yet.
Something to keep in mind is if you are using an internet, or your family are using an international credit card like MasterCard or Visa, always good to take a look at their terms, because they often have a small coverage for travel insurance. So always a good idea to take a look at what credit cards provide. There is some small coverage for travel insurance there.
Good point.
Good point. Elena, anything to add to this?
No, I think like just to support Nusha and Rupa, right now I don't think that it's going to be possible that the family is going to be traveling. Even like some cases that students are not going to be able to get their visas, so they're going to close that to only essential um, travel. So I think it's also right now not the moment, even like for the health of your family, to take care of them. So if it's only one moving, it's fine. You take your things, you be prepared and everything. But if they're going to move like the whole family, just remember that probably they will ask you to be in quarantine with all your family, and it'll take longer. And yes, and I don't think that the housing from your school will be like, hey, yes, the family will be here for 2 weeks until they finish their quarantine. So also check that.
Jorge?
Yep. We hear a lot about discrimination and human rights issues. For example, the recent hashtag Black Lives Matter movement. What are your recommendations on how to deal with issues like that?
I can take that.
Sure.
So somebody asked me this a couple of years ago when I was at another school, and they said, what are you going to do about the bias and hatred in this country? And I said, I am going to educate my students. So respect for all human beings is all of our responsibilities, right? All of our countries have a history. And if we look at history, no matter where in the world, there is always something there not to be proud of. So part of it is recognizing that human beings are human beings and all human beings make mistakes. Our job is to learn from other people's mistakes. It's important to maintain our dignity and maintain the dignity of the people around us, right? As long as we are courteous, we are well behaved, I don't see any issues. I think the Black Lives Matter piece has been more about police brutality towards a certain race in the United States, and then the protests, and those are serious issues. It is a sad part of America's history, and all of us have been a part of the pain that we are experiencing. Nusha and I were talking just before we started this presentation, and we are talking about being activists, right? We all have a responsibility to educate and to support. So as we welcome our international students, so on my campus, we are actually doing a book reading on Black Lives Matter. With my staff, I am doing dialogues and discussions about Black Lives Matter, building a better awareness. I think one of the things you will learn as you come to the US as students is that your campus will also have these dialogues. You will have a division of institutional diversity who will do presentations and awareness workshops. Please be a part of those. You will find as you live in the United States, we are very mindful of the language that we use. We want to be loving and respectful and supportive. And as educators, that is definitely our commitment to everybody around us. So we look forward to welcoming you and to having you be an active part of this dialogue. Help us to see how we can do differently and how we can do better.
Yeah. And if I can just add to that, I know sometimes that what we see on TV can seem really scary, and it's okay to have that feeling. But I personally sometimes see these things as opportunities and as points of inspiration, because as Rupa said, there are things in every country's history, and we are no exception to that we are not proud of. But what's amazing is that people are trying to change it. Right. So being a part of those conversations, really understanding, what the movement stands for too, is really important. And I think that in as much as there's always pain, and things always have to be kind of bad for a while before they get better, right? And then you kind of go through that again. That's how society moves and shifts. And we're going through that. And I actually personally think that we are experiencing a beautiful time in life. In as much as it's a little chaotic, sometimes it's a little crazy looking. And another thing with the news, just in general, I always tell my students this, the news focuses on what's happening in a specific place at a specific time, and it normally shows you the worst thing possible. Why? Because that's what people pay attention to. It's not, you won't find things like what's happening, for example, in Portland over the last couple of weeks, or Chicago, everywhere. It's happening in Portland or Chicago. So if you are concerned at all about your safety, talk to your schools, talk to other students that are there. If you are interested in the movements, get involved. You as international students still have a voice in helping change the American landscape. So get involved and be a part of these things. And like Rupa mentioned, get involved in those discussions on your campus. They can be incredibly eye-opening. And what's interesting is that you'll find that, you know, the US experience for minorities might be very similar to the experiences of minorities in your home countries. And you can bring that perspective to the conversation as well. So it's an opportunity, in as much as it might be a little nerve-wracking, a little crazy, but it's really an opportunity for good and for change. So I for one am happy that we're going through these things in this country right now.
I would just like to add something. My recommendation is that never generalize. So it's not like they mentioned, it's on the news, yes, but that doesn't mean that everyone is like that. Of course, every country has their, like, each problem, I'm sorry, because I remember when I was in high school, and there was a time that my city, Ciudad Juárez, was one of the most dangerous cities in the world. That was like the news. I saw them in different places, and they were like, oh, this happened in Ciudad Juárez. And I was like, I live there. And I promise that I know my city was dangerous, but sometimes what you see in the news is really different on what we live here. So of course it's not the safest city, but we have to take our precautions. So it's something that we need to learn. So of course, never expose yourself on something that you know that it's dangerous, and always be informed, again, with reliable sources, and don't let that the news, either the social media, take away your calm. That's it.
Yeah.
Thank you.
Don't let it take away your calm. I like that. Hashtag.
Yeah. Speaking of safety, I want to share a story. Elena reminded me of this. It relates to a lot of these pieces. A couple of years ago, I was working with a student who had been attacked. The student was walking from the library to the residence hall at 1:30 or 2 in the morning, and was attacked by somebody. The student was injured, and we were working with the police to find the attacker. The student had received treatment. And the student said, my father told me to come to this school because this is the safest school in the United States. You have cameras everywhere. How did this happen? And I said, the cameras are there to tell us what happened, not to stop people from doing things. We still have to be careful and not walk at 2 o'clock, single person walking at 2 o'clock in the morning, and it was a girl. So to Elena's point is, don't put yourself in harm's way. America is a very safe place. We do have cameras, but the cameras are there to watch, not to prevent, right? So make wise decisions. That is great advice that Elena is giving you.
Also, another thing that I just remembered, and I'm sorry, I'm always interrupting, sorry. And if something happened, and you don't need to keep that to yourself, and always do a report. We have the police department. So if something happened, because as I already mentioned this, life happens, an accident, something like Rupa mentioned right now, that you're exposed and something happened, never keep it to yourself and be like, oh, it's okay. I don't want to say anything because I don't want to cause any problem. No, open a report. And I know that the police department, either in your university with company with your city's police department, they will work on it and they will help you. So never feel that you need to, like, I don't know, compress your feelings or be like, oh no, I don't want to cause problem. It's okay. We all have those days, and we don't want you to feel attacked or like Of course, if it's something about a person and they just made a comment, you don't want to file a report on the police department or everything. If it's something like that, but if there's a stalker or there's someone that is chasing you or they are telling you things that you don't like and they're really like often, since day one, put that report.
Thank you. Jorge, is there anything?
Yeah. Will your universities offer in-person classes this fall? And if so, what kind of measures will be taken to protect students?
We have
I
hybrid
am
classes,
not.
Nusha.
Yeah, I am not. So I'll let the others.
Okay, I can go. Northeastern University is planning a hybrid model. And so the way we are looking at our classes, the faculty will obviously be in charge. Your professors will be in charge of designing the classes. But what the students are going to have is a week by week scheduling opportunity, right? So say a student has just arrived and has to be in quarantine. For that week, that student will tell the professor, I am in quarantine, I have to do my classes virtually. And so then when the student is able to, the student can say, okay, this week I can do in person. We are keeping our campus de-densified. I am actually working on my space assessment. I had to miss a meeting so I could be with you today. We will be, I supervise an office of 30 people. We will obviously, all 30 will not be in the office at the same time. Similarly, in classrooms, some students will come to class. The professor will have a camera that will beam classes remotely to students, whether they are in the same city or they are overseas. So on my campus, we are going to work with all the different possibilities to offer our students different flexibilities so that everybody can stay healthy. What about your campus, Elena?
Okay, so for UTEP, we have the same. We have classes that are going to be 100% online. So in here, the student has the option to decide his schedule. If he wants all his classes online and he wants to be taking his classes in Mexico City or in his city, that's fine. If the student decide on taking hybrid classes, of course, we'll work with the professor, and it's a percentage of that class will be virtual and a percentage will be in person. If it's the percentage that it's in person, of course, it will be a lot of security measures there. The capacity of the classroom will be like 50%. So it won't be like, oh yes, we decided on taking in classes, courses, in-person courses, but we are here like my group of friends. No, of course not. There'll be like one student and then 3 seats left and then another student. And of course, if you don't feel secure or if you don't feel like, you can talk to your professor and go back to online. Another thing that it's important, like Rupa mentioned, is that I work in the Office of International Programs and Study Abroad. So that's also important to take care of the students and our staff, is that we won't have like just office hours where you can go like before. And right now everything will be virtual. So we're trying to maintain like the less that we can see each other in person, the better for everyone. So if it's something like it's really necessary, go ahead and do it. Another thing that it's important, right now we know that if you decide on having your online classes, there's also grants or scholarships or loans that you can get for you to get a computer. I mentioned that because probably a student is like, oh, I probably need to go in person because my laptop is not working and I don't have right now the money to purchase a new one. That's also another idea that you could look, is that we can help you get a computer or even rent one in our library for you to keep on with your classes.
Okay, well, I think it's the last question we have. We have a couple of 2 slides for information for all the students. Next one, please.
Okay, yeah, I think this is the last one though. It's regarding insurance services. And what if an accident happened to me off campus? That's the last one.
Oh yeah, your insurance will cover that. We'll just leave it at that because I know we're out of time. But yeah, your insurance will cover any accidents.
Thank you, Nisha.
No
okay, next one. We're going to have another session on July 28th from 5 to 6. It's going to be another panel with experiences of Mexican students in the United States. You can register at the following link. And we also have the last slide, which is all our contact information. We have email, Facebook, Twitter, Instagram, and we have a blog for all this information. Thank you for joining us, and thank you for our participants. Thank you for being on the panel.
Thank you. Thanks for having us.
Thank you for the invitation.
Thank you very much. Very nice to be with all of you. Good luck. Do well.
Thank you.
Good luck.